Dear friends, did you know 70 to 85% of the women in India lack calcium and vitamin D in their body? And out of every three women has bone mass density less, which can lead to fragile bones and osteoporosis. Good morning, this is Dr. Suraksha, and today we will talk about women health and calcium. Why only women we are talking? Because in women there are different phases in their life, like pregnancy, lactation, multiple pregnancy, abortion, and menopause, which all can affect calcium health. Now pregnancy, we know that fetus bones are formed, and for that dietary increase requirement is there for calcium. However, even if the mother doesn't take proper calcium in her diet, the fetus will anyhow take the calcium from the mother's bones and stores. So mother's bones calcium goes down. And then comes lactation. Every day when she is breastfeeding, 400 milligram of the calcium goes to the child. And then comes menopause, in which estrogen becomes less even 10 years before menopause starts. And what is the function of estrogen? Estrogen protects our bones, and when the protection is gone, bone loss with aging increase at the faster rate. There are chances of fragile bones, osteoporosis, and the fractures. Indian women has 10% more chances of early menopause also. Even before she becomes pregnant, Indian diet has less calcium compared to the Western diet. Daily requirement of calcium is 1000 milligram per day, but our diet usually contains 500 milligram. So we need 50% more than what we are eating. So why calcium is so important now? Calcium is required for the bone health, teeth health, nerves conduction. Any current or any movement happens, for that nerve has to function like wires. The conduction becomes slow. Muscle contraction, if I'm picking up something, these muscles are contracting to pick up that contraction become weak. Then it's important for the hormone release. It is important for the hair, skin. The nails become brittle, hair becomes dry, skin becomes dry. So, and the last but not the least, for heart health, to pump the blood in the body, heart requires the strength and the power. If calcium is less, the power goes down and it cannot efficiently push the blood in the body. How patient will know that she or he may have calcium less in the body or weaker bones is muscle cramps and spasms, tingling and numbness because of the nerves affected, generalized fatigue state, having low back pain, and difficulty in the climbing the stairs, irregular heartbeats, brittle nails, dry Now, how skin. To receive calcium from our diet? You can see what are the best sources of calcium in this table. First three are from dairy products, and you see if even you take 1 cup, approximately you are getting around 300 milligram of calcium. Even cheese has 3 centimeter cube, 250 How patient will know that? However, you should look into she the or he may have associated with that calcium also. And less in almonds, body, 1/4 cup has 95 is muscle cramps and spasms. However, almonds tingling and numbness, if you have a high cholesterol and other problems, you should generalized fatigue state is associated with each having low back pain. I will see milk and dairy and products, difficulty in the climbing the stairs, irregular heartbeats, brittle nails, dry skin,